As I sit here today, this issue is very frustrating and saddens me, and I wish that I could take the opponents of this issue and put them in my seat. I wish I could take Governor Corbett and have him walk a day in my life. As I sit here today, I'm going to testify to you wearing two hats. I'm going to provide testimony wearing the hat of an employer in Erie, Crawford, Warren Forest, Venango, and Clarion counties. Voices for Independence is a center for independent living. We offer skills training to individuals with disabilities, peer counseling to individuals with disabilities, advocacy services to individuals with disabilities, and one of the largest components of our work is that we are also a home care agency, because attendant care is a service that an astronomical number of people with disabilities need. I'm responsible for 40 office staff, most of whom have significant disabilities. I also have responsibility for 664 direct care workers or personal care attendants. As an employer, I have seen in year 2013 a 59% increase in my health insurance costs for the insurance that I offer my 40 office staff. 59%. That has forced me to make some very painful decisions. That is, to switch carriers with higher deductibles and less coverage. But I'm embarrassed to say that the 664 direct care workers who I employ, I cannot offer health insurance to. It is my desire to insure those 664 people, and that number grows daily. At present, the overwhelming majority of those workers are making between $9.64 an hour and $10.05 an hour. As I told you earlier, I sit here wearing two hats. I come before you today as a consumer of the Act 150 program, which is a state-funded attendant care program, and without it, I could not work. My attendant comes into my home This is a very personal.
You can take your time, please.
Some water. Need some water.
Yeah. Take your time.
My attendant comes into my home, as she did today, at 5 a.m. every morning to get me dressed so that I can go to work. Without her, I wouldn't be sitting here giving in-person testimony.
Folks who get their paychecks. Right.
She is and has worked for me for 10 years without health insurance.
Let's give Shona some help here, okay? You're bringing it on home. Take your time. Bring it on home. People need to see the reality of health care and what it means to people.
I'm sorry.
You don't have to be sorry.
Don't apologize. You're all right. You're doing good. You're doing good.
She is married with a combined household income of $30,000 a year, has 2 children, one of whom was kicked off of Medicaid a year or so ago, and the other is insured. she cannot afford to take time off of work, so she works often ill because her employment provides stability to her family. I feel guilty because every day she dresses me for work. I go to work. Because of that, I have health insurance. My attendant, who is so vital to me, and provides this service, can't afford preventative health care, can't afford to be sick, and has to continue to try to provide for a family on a barely livable wage with no health insurance. I ask you to look at the injustice in that. And she is one example. As I said before, I'm responsible for 664 people who are uninsured. And I don't know many of their faces, to be honest with you, because I can't. But I know that her story resonates among that group of people. I am willing to do whatever it takes to help you move this agenda forward. Again, we're talking about people who are vulnerable. We're talking about people who have the desire to work. We're talking about, the numbers vary, but anywhere between 500,000 people and 800,000 people in Pennsylvania who would be qualified workers with the hand up that they need to be more independent and self-sufficient in our communities. Medicaid was never intended to be a program that didn't help our people become more economically self-sufficient. We've proven that. So please, I urge you to go back to Harrisburg, represent our people.
Thank you.
Thank you.
Thank you, Shona.